I chose this residency not only for the location, but the diversity of patients. Austin's set to be one of the largest cities in the nation within the next 20 years. And Baylor Scott & White has been an integral part of the healthcare system in this area. We have a lot of feeder hospitals from outside of the area. So we have patients coming in from all the way out in Llano or Marble Falls and surrounding areas, which really adds to the diversity of the things that we see.
We believe that residency training should open up the future for multiple career paths. All our residents are ready, whatever career path they choose.
What I enjoyed about our program is that we have a great professional working relationship with our faculty. They are invested in seeing us succeed, and not only succeed as professionals, but also have the opportunity to stay here to work at Baylor Scott & White. So now I'm working along my mentors who have shared their 10, 20 years experience with me, and I have the potential to work with our residents in the future to see them succeed as well.
I'm in charge of the Sun City Georgetown Internal Medicine Rotation, which is extremely popular. I'm also co-director of the residency program. The rotation's popular because the residents get to interact or work alongside highly skilled internists, and we're able to manage very complicated patients with minimal dependence upon the subspecialist. I'm also involved in Morning Report, which is the highlight of my day. It's case-based presentations by the house staff in the morning. We have fantastic pathology and learn an awful lot from that venue.
When I work with residents, we basically address primary care issues of the elderly. So we're doing a lot of cognitive assessments for people with possible dementia. We're seeing patients for balance problems, and we do falls assessments. We also look at medication profiles and look at the risks and benefits.
It's my goal to eventually be a hospitalist when I graduate, and this program has really helped me excel in my future career goals. Our faculty is great. 3 of the hospitalists are part of our core faculty, and they're great teachers, and I've learned a lot from them.
I'm one of the hospitalists with core faculty at Baylor Scott & White. It's a small community program, but very hands-on training, very close-knit community, and we get to see a lot of bread butter stuff as well as a lot of rare stuff too.
The inpatient medicine rotation here, of course, I think is a fun one for our residents. I think one of the strengths of our program, especially on the inpatient rotation, is the camaraderie that we have. We really enjoy what we do, and the residents as well as the faculty really get along very well, and we have a supportive environment and a shared love for learning and care for the patient.
Our program here in Baylor Scott & White at Round Rock is a very close-knit program. We enjoy working with each other. Residents really learn, and when they are ready, after 3 years, they are ready to practice.
Completing your training here in Round Rock allows you to have access to library resources through Texas A&M, and you also have access to the informatics department through Baylor Scott & White. This allows you to have all the resources you need to complete any sort of research project you're interested in. Being in a smaller program also allows you to have closer relationships with your faculty and mentors in completing these research projects. Coming to this program, you'll be prepared for completing a fellowship or pursuing a career following your residency.
The Cardiovascular Fellowship Program at Baylor Scott & White Austin region is focused on training clinical cardiologists in all competencies required for running a modern cardiology practice. Our curriculum and rotations are based on the COCATS 4 guidelines and provides a robust training in preventive cardiovascular medicine, acute cardiac care, echocardiography, non-invasive diagnostic testing, and cardiac catheterization.
At Baylor Scott & White, we have a wonderful quality improvement program for our residents. Our internal medicine and family medicine residents work together on the quality improvement projects. Our residents have a lot of instruction and direction by our quality improvement team, by our faculty members, and one of the really great things about our quality improvement projects is that these projects get input from our administrative leaders. These are projects that really are shaping the future of our hospital.
Lifestyle medicine is a track that I'm pursuing, and it's basically focusing on my patients' lifestyle in addition to their conditions that we treat with medicine. So we focus on working on their diet, working on their relationships, their stress management, and preventing a lot of the complications that chronic diseases can cause.
Lifestyle medicine is the evidence-based practice of helping individuals and communities with lifestyle changes to prevent, treat, and even sometimes reverse chronic conditions. Our residency program is fortunate enough to be one of the few lifestyle medicine residency curriculum sites across the country.
Our program coordinator, Taylor, is awesome. She not only is a great friend of ours, but also is a hard worker and really is available 24/7. Any questions, concerns, anything that you need, she's there for you. She's a great colleague, but a great friend, and we're so lucky to have her.
At Baylor Scott & White Health, we have a data-driven and integrated approach, and specifically in Austin Round Rock region, we take that to the next level and execute efficiently on it. And our system is integrated very tightly. The hospital, the outpatient, and primary care and specialists are all integrated to one EMR, and we truly collaborate on almost a real-time basis. Our primary care more than doubling in size from number of sites and provider standpoint. Also led to our hospitals growing from 3 to 7 hospitals. So this would be an excellent environment for residents to get trained in.
Austin is great because there is a lot to do, a lot of really good food, Tex-Mex, barbecue, anything you could imagine. There's a lot to do on the weekends. There's a great music scene. I like to go hiking, and we like to do water sports on Lake Travis. We either rent boats, we go paddleboarding, kayaking. If you like shopping, there are many different places to shop. The outlets are right across the street, and then Barton Springs Mall is close by. There's farmers markets that run year-round.
A couple of our core values at Baylor Scott & White Health are that we're in it together and that we never settle. And I think that the residency program really exemplifies both of these values. Being in it together, I think, is looking at our hospital and seeing our residents collaborating with our physicians on the floors to deliver the best care for our patients. And then never settling, I think, is really a reflection of how the residency program has helped our hospital to evolve to deliver even greater levels of care for our patients, and shows how far we've really come as a hospital and obviously as a residency program.
Here at Baylor Scott & White Round Rock, our residents have a unique opportunity to be part of a small program where they have personalized training in a friendly environment, and all at the same time have access to all the resources a big healthcare system has to offer.